Hello, everybody. Welcome to our program, Consciousness and Evolution. My name is Ana Yogan. I am representing Reaprendência International, a conscientiocentric institution dedicated to brain education. You can find our page, Reaprendência International, at YouTube, Facebook, and Instagram. Today, we are going to talk about a public health issue. Lyme disease is an infection caused by the bacterium Borrelia burgdorferi, which is transmitted to humans through the bite of infected black-legged ticks. Many people believe that it's confined to specific areas of the US. However, a comprehensive meta-analysis of 89 studies conducted between 1984 and 2021, encompassing over 150,000 blood samples, revealed that approximately 14.5% of the global population has been exposed to this pathogen. Despite this high prevalence, Lyme disease often goes undiagnosed due to non-specific symptoms, inaccurate early testings, and underreporting. Please, let's welcome our guest, Dr. Carlos Levischi.
Hi, hello. I'm happy for the invitation.
Thank you so much to giving your time and being here with us. We know that you are super busy, but Dr. Levischi is a distinguished Brazilian medical doctor specialized in Lyme disease and associated infections. He earned his medical degree from the Faculty of Medicine at Pontifícia Universidade Católica de São Paulo and completed his residence at the Hospital das Clínicas of the University of São Paulo. Furthering his expertise, he pursued advanced studies at New York University and received an immunology training at the Harvard Medical School. Dr. Levischi is the sole South American member of the International Lyme and Associated Diseases Society. He is a leading authority on Lyme disease in Latin America, a region where awareness and understanding of this condition are limited. Dr. Levischi emphasizes a humanized and integrative approach to patient care, believing that these elements are essential for accurate diagnosis and effective treatment. His contributions to medical literature highlight the clinical complexity of Lyme disease, particularly in its disseminated stages, and advocate for increased awareness and education among healthcare and professionals in Latin America. So welcome, Dr. Levischi. The stage is yours.
That was a nice presentation, so I'm very happy about that. And Lyme disease is a problem in the world. It's most common in the northern hemisphere, but here in South, we have the problem too. It's not as high that in the north of the planet, but we can say that we have cases in our regions here in Brazil. So with the internet, it's common a new disease because the first cases was reported in 1990, and between that time and now there is a lot of more cases, and the internet is helping a lot to that we can say about the disease, we can show about the disease, we can publish like cases about the disease here in Brazil. So it's a nice beginning. It's something that we in Brazil are trying to warning most of the people about the tick, because here we have the mosquito, and the mosquito transmitted disease that we have a lot of cases and a lot of people talk about it, but the tick is dangerous too.
Oh yes, absolutely. So this kind of a disease is very complex because it kind of gives you very unspecific symptoms. I'd like you to share with us how the patient would arrive to you, because we've seen many cases where the patients go to so many doctors and even infectologists. Like my sister is a patient from Dr. Levischi, and she went to an infectologist that said, "Oh, there is no Lyme disease here in Brazil." And how come that things are in this kind of situation?
You, if we have the bullseye hash, it's easy to to make the diagnosis, but the problem is if the patients don't have the hash, because the hash can be showing the beginning of the first phase of the disease, like the localized disease. It's like an acute disease, and in that time the patients could have some kind of flu symptoms too, but uh, the Bose hash is the most important signal about the disease, but not all the patients have the signal. It's like in US we say about 30 to 50 patients could have the bullseye hash, but in Brazil it's even lower. We talk about 10% of the patients has the hash. Most of the patients don't have it, and they have like flu symptoms and go to the doctor. And almost all the cases we think that it's like a flu or something like that, and the diseases in that time disappear and appear after some times, like months or even years. And we have the disseminated disease that is more harsh to treat and more harsh to diagnosis, and it's a hard disease because in the late phases we can have like autoimmune like symptoms. It's common to the patients goes to like a hematologist, and they do all the tests for autoimmune diseases, and almost all the tests could be negatives, and is even worse because the patient goes to a lot of doctors to try to get a diagnosis and the correct treatment. And it's common to see a lot of doctors before the diagnosis, like your sister. So,
Yeah.
and you talked
She
about,
was very lucky that she had the serology positive, which is something that may occur as well, right?
yeah, because in the late stage of the disease, we can say that about one half of the patients has the serology positive. So it's important to know about the disease, to know about the clinical picture, and with the clinical picture and the the serology, we can try to make the diagnosis. But it's a hard diagnosis. It's not common if the medical doctor is not seeing not see the disease uh, frequently.
Right. Yeah, I remember like being a physician, I studied in Brazil, and I had like infectology classes in the fifth year. And my professors, they just kind of pass it through when talking about Lyme disease, because they would just dismiss it like it doesn't exist in Brazil, it's just in Europe and the US. And you you wouldn't be thinking about this. We have now a question here. Eliane Voslava would like to know how was the process of writing the book about this issue, which is not so known among people. Usually doctors don't mention and research this possibility of Lyme disease.
Yeah, it's hard because like I have a lot of cases here in Brazil. So because I could be one of the only doctors that sees the disease. So I have a lot of cases, so a lot of study, a lot of different clinical pictures. and I have to read a lot of book and research about the articles. This was the way to write a book about it. But the book is not a medical book. is more a book for the patients to read and recognize the symptoms and try to make the diagnosis. And after that, they told their doctors to do the exam. A lot of my patients, the patients talk about the disease and told the doctors to do the exam, and after the exam, they come to me.
I understand. Uh-huh. And your approach is very differentiated from other doctors. And generally, the doctor kind of gives you a medication and don't really worry about if you are going to have so many side effects and this or that. And your follow-up is it's very, very close to the patient. Your relationship is also very, very compassionate. And that's something really rare to see in medicine. Like I am here in the US and I've been to several doctors here. And I would say that I found this in 5% of the times that I was looking for a health provider here. So how would you kind of say it was your trajectory to find this kind of approach to your patients?
Because we were talking about a disease that is not so recognized here in Brazil. So if the patient has some kind of side effects, they go to the emergency room or some kind of urgency appointment, and the doctor that will attend it, most of the time they don't know nothing about the disease. So I have to do this kind of follow-up, because it's not an easy treatment. There's a lot of medications, a lot of antibiotics, and I have to see how works the kidney, how works the liver when we have a lot of medications. So it's a very close follow-up to try to not harm, first of all. And here in Brazil, the variant of the disease is more harsh to treat, because they have a lot of autoimmune symptoms. And the disease we treat, then after a while the disease come back. It's not uncommon, because the patients with the Lyme disease has to live by a lot of restrictions, because the immune systems have to work well. And it's not uncommon that the patients has some kind of stress, some kind of feed disorder, try to eat something, the disease come back.
Have a flare-up.
Yeah, a flare-up.
Mm-hmm. Yeah.
It's very common in English literature, like the flare-up. So we have it here too.
I also was impressed to read about a kind of studied some about the disease, and there was that documentary, The Quiet Epidemic, and the silent epidemic, right? And it has that issue that the CDC says that this disease is only acute. That you should just treat the patient that has the serology positive, or that has the bullseye signal with one round of antibiotics, and that should be fine, because the chronic Lyme disease, theoretically, for some doctors, it doesn't exist, but it's not the truth. We have seen so many patients with those problems, and the consequences are evident, right?
I think that is something that is changing. If you have seen the CDC page about 5 or 6 years ago, they don't say anything about the disseminated disease. But if you say the pages today, they they consider the disease. They say that we need a lot of more research about it, but they say that the disseminated phase of the disease the chronic phase disseminated of the disease could be something. And there's a lot of serious institutions in the West that are like doing research about the disease, the disseminated disease. And I think in the next years we will have some kind of good look about it, because now there are so many doctors in the US, not only the LLMD. I'm saying about a lot of doctors in like famous and prestigious institutions doing some nice research about the disease. So I think it's a matter of time.
Oh, that's a good thing to hear about. So let's talk about the tick. How is the process that the tick gets to bite somebody and then that person becomes contaminated? I was looking at the life cycle of a tick, and it has some phases, and we can be contaminated in accordance to those phases of the life cycle, right?
Yeah, in the northern hemisphere, we have some kind of more season climate that you don't have here in Brazil. So you guys have like winter and summer. They are well demarcated, and the tick has 3 phases of life. Before the after the egg, the tick has a larva form, and after that a nymph form and the adult form. In the larva form, the tick could bite some kind of mammifers and birds and carry the bacteria, and the bacteria uh, start to grow in that tick, and after that the tick has to transform to a nymph, like after the larva state, and the nymph could transmit the disease for the humans. And
the nymph is a minuscule thing,
yeah,
right? It's like a needle point.
Yeah, it's like a pop seed. It's really small, and they could transmit the disease to the humans with like 6 hours of the tick is in the skin. It can transmit the disease.
Wow.
And it's more common in the summertime because it's the cycle of life of the tick. In the summer, it's common to beat, and after the winter, the tick goes back to the soil and do another transformation for the adult form, and the adult form can transmit the disease too. I say the most common tick to transmit the disease is the exotic complex.
Mhm.
It's very common to you guys have like some kind of deer, the mouses that have the bacteria, and the tick bitten that kind of animals and get the bacteria too and transmit to the humans.
I see. I have a question here from Dr. Leona. She's asking if there is a vaccination for the mosquito bite, but I think it should be the tick bite, right? Because it's not transmitted by a mosquito bite.
Yeah, we don't now have all the informations that mosquito can transmit the Lyme disease, but ticks, yes. And if you are trying to say about mosquito transmitted diseases, we have some kind of vaccine here in Brazil for dengue. It's a new vaccination that we have. We have vaccinations for yellow fever that can be transmitted for mosquito too, but not for Lyme disease, because there is a vaccine being researched. We have a vaccine in the past, but the vaccine could cause symptoms too. Because of it, the vaccine was not that vaccine was not more apply to the people. And now we have a new vaccine being researched. I think in the next years we can have it.
And it's so curious because, like, I have two dogs, and my dogs were vaccinated for Lyme disease, but we people don't have a vaccine available, right?
For Lyme disease or for like another tick disease transmitted by dog for the dogs?
Yeah, it might be that. I
because
think.
because the here in Brazil we call the tick disease in dogs Ehrlichia. Is
Oh, it's
another
another
bacteria.
bacteria.
It's not Borrelia. So I don't know about a vaccine for the dogs for Borrelia,
I see.
but I have to see about it.
Okay. Yeah. And another question that comes to mind is like, okay, the patient was bitten, so this disease, it goes to most of the times to a latent stage, and then it flares up by some other infection, like sometimes it flares up during COVID. It's something that happened in the past during the pandemics. It can also flare up with other autoimmune diseases. What do you see that it's more common, and that in terms of us, in terms of our population and families, we should pay attention and keep that in mind?
Yeah, it's very common. I saw it a lot in COVID. There is a lot of patients that was nice about the disease. The symptoms are controlled, but with the COVID or even with dengue here in Brazil, the the disease has a flare up. So I told to all my patients we have like pyramid with three legs to maintain the patients in good state. Like we have to have a good diet. We have to have physical exercise, and you have to we need like peaceful mental state. If you have a better limitations, if you have sedentaries, and if you have like a lot of stress, and the stress could be emotional stress or organic stress, like a viral infection, or even some kind of vaccinations that it's common here in Brazil. The patients go to the vaccinations clinic, and they do a lot of vaccines together. I say to all my patients that it's really important to take the vaccines, but it's better to like take one and wait
At a
like
time.
30 days and take another, because to minimize the immune distress that we can have in that time. And I think is the best way to control the flare-ups. There's a lot of patients that it's not so good because they think that the antibiotics is all the things that they have to do about the disease, but this is not true, because a lot of the way in treating Lyme disease is done by the patients, because the patients need to take a decisions that they have to eat well, they have to do physical exercise, and they have to do everything to work with the stress. That a lot of now of psychotherapy that teach the patients how to manage with the stress.
Manage.
And this is important when we talk about eviting flare-ups.
I see. Yes, so it's like a multidimensional level of care that you offer to your patients, and this certainly makes a huge difference because many patients, they would come to the doctors and just think like, well, I will take a magic pill that is going to make the disease go away. Okay, it's a bacteria, but it's a very special kind of bacteria that hides very uh, easily, and becomes latent in the tissues. And despite of the medications that are used, it will be still there left. They can form biofilms as well, right?
Yeah.
So the mechanisms of avoiding the treatment, this seems to be a very smart bacteria, right?
When we talk about the bacteria, the Borrelia has the most advanced
Lancet.
DNA. It's
Mhm.
he's a bacteria that needs a small amount of oxygen to live. So the bacteria can hide in the tissues that has less oxygen. With that, the if you don't have oxygen in that tissue, you don't have immune cells as well. So it's more difficult to the immune system reach the bacteria. It's more difficult to antibiotics reach the bacteria, and all of that difficult to treat the disease because if we use a lot of antibiotics for a standard time.
We have a question here. Marcelo Pires is asking, commenting that in Europe there is a meningitis disease transmitted by ticks. It is endemic, but luckily there is a vaccine available that protects for a period of 10 years. Do you do you think this should be for Borrelia, or
No,
it
no,
should be for
it's a
probably other diseases that
yes,
associated with the
it's a
ticks, right?
viral infection. The
Oh, I
ticks in
see.
Europe can transmit a viral infection too, an infection that can cause encephalitis. It's a very uh, a very dangerous disease, and they have a vaccine for that, but not for Borrelia, just for the virus. It's more common in the like Germany and Eastern Europe, but there's a lot of people that can go to the forest and the woods and was bitten by the tick and get this disease. So it's nice to have the vaccinations because it's a easy way to avoid the encephalitis virus caused in Europe.
Okay. And despite of the treatment, we see patients that they don't get better with the treatment. So because the tick not only transmits the Borrelia, it transmit other diseases as well.
Yes, in US we have that more documented, and we call that co-infections. Here in Brazil, we have it less documented. We have another kind of bacteria, virus, and other microorganisms that can be transmitted by ticks. Like it's one of that is well documented in USA, and here in Brazil, it's Babesia. Babesia is not a bacteria. It's can cause like a malaria-like symptoms. Is a protozoa. Is like a causing of the malaria. We have it in Brazil too, but it's not so common see. Here the more common bacteria transmitted by ticks is the rickettsia that causes maculose fever. In US is like the Rocky Mountain fever. It's the rickettsia. The rickettsia is it's a very dangerous bacteria because they causes the maculopapular lesions in the skin, and the lesions appears like 4 days after the disease begins, and at that time the mortality can reach like 50% of the patients. So it starts with flu-like symptoms too, and after for 2 to 4 days, for 8 hours to 4 days, they can start with the lesions with the skin, and the mortality rises in that time.
Mhm. And which measures would you recommend to the patients to prevent Lyme disease? It's basically don't get bit.
Yeah, but we can say to the patients, don't go to the outside to do uh, like to leave the countryside live. So you can say that to the patients, because it's nice to do that kind of, yeah, go outdoors. It's nice for and we have to do some kind of avoiding the tick. Is the best way is using some kind of product that can avoid the tick. The most common contains a substance called DEET, like DEET, is the more effective for tick bites. And after you do an outdoor day, you come back to your home and try to look for ticks in your body, because if you find a tick, it's very important to use it like a tweezer, yeah, and take the tick off. In the US, you have some kind of laboratories that you can send that tick and see that if you have some kind of contamination. Here in Brazil, you don't have that. So after that, you have to look for symptoms. If you live in the US in an endemic area, you can try to get some antibiotics to not have the disease. It's called prophylaxis. You can do it in USA in endemic areas, but in the other areas we don't have that kind of orientations. So you take off the tick and see for symptoms, like if you have some kind of flu-like symptoms or skin lesion.
Okay. And also, I just read a book. It's called "It Lurks in the Woods." It's about women. She wrote this about her husband, and he had symptoms of Alzheimer. And in the end of the story, what he had was Lyme disease. And that was quite surprising for me to observe, but I guess Lyme disease can present itself in so many ways that we shouldn't really be surprised, because it's a very complex disease, right?
Yes, because the bacteria itself don't have harmful mechanisms, but the problem is that they can activate the immune systems, that are some kind of proteins in the bacterial membrane that can like lure your immune systems to attack some kind of self proteins. And there is a lot of proteins that being recognized in literature that the bacteria can emulate. So it's some proteins that we have in the brain, and your immune system will start to attack that cells because of that proteins. We call it like molecular immunity. So the Borrelia has a lot of it, and in that way, the bacteria uses the immune systems of each patient, and they can do different clinical pictures. So because of it's so hard to diagnose, that there are some research in literature that found the Borrelia brain with patients with Alzheimer's disease. So it's something that is being studied, and I think in the future we can know more about it.
Yes, and some patients even present themselves with behavior symptoms, and like depression and anxiety. How can we kind of suspect of that possibility? What would you recommend to the patients that might have this, and what else they would look to think about Lyme?
The problem is that we have now some specialized doctor, that a doctor that see only the mental issues, another doc see only the arthritis, another doc see only the skin. It's a problem because normally Lyme disease patients has a lot of symptoms besides the psychiatric symptoms. Mm-hmm. So we have to look about it. And if it's a patient that have depressions or anxiety that is difficult to treat, it's good to see another options and to start to talk about other symptoms that patients could have too, like skin lesions, or even some kind of joint pain, or some kind of fatigue. So it's common the patient has a lot of symptoms, and look for doctors to treat only on one segment. And if you see the like this kind of the mental symptoms that the patient with Lyme disease has, it's very difficult to treat with the medications. So it's common the patient has a lot of tries in psychiatric medications, and with small answer.
Okay, so difficult answer for like a lot of trying a lot of medications without getting any help.
Yeah,
Let's put it
like
this way.
any results. So
Okay.
it's common, and the problem is that the doctor don't think about the diseases, and if the doctor don't think about the diseases, it's hard to diagnose.
Yes, and it's very difficult because sometimes what looks like is like that that patient presents himself to the doctor, and the fact that the doctor cannot make a diagnosis, they tend to dismiss the patient or dismiss the symptoms. Like a lot of women, we were talking about aging the last life that we had, and you know, with menopause and aging, we have a lot of symptoms, and most of the gynecologists here in the US, they mostly dismiss those symptoms and say, well, it's a normal process of your body. You have to go through it. And it's not easy. Like you feel like completely not validated.
Yeah, there's an expression in English, I can't remember the correct expression, that you have that kind of symptoms and the doctor don't validate that.
I would think maybe the clinical gaslighting.
Yeah, gaslighting
Right?
is the correct expression.
Gaslighting. Mm-hmm.
Yeah, so it's something that we start to use here in Brazil, this expression, gaslighting. Sadly, is something that we see in the clinical practice.
Because at some moments, like we have to admit that we can fail and we can not know everything, and maybe tell the patient, well, just go see another opinion because I extinguish what I know of possibilities. I remember clearly when I was still a young resident, and I had this patient that used to come to the ER so frequently with chest pain. And we would do all the cardiac workout, EKG, cardiac enzymes, sometimes even an echocardiogram, and everything was completely normal, and nothing would explain the pain that he would having. And I remember one of the times I saw him, and I talked to him kind of frankly, and I said, well, I have here that you came here almost 30 times with the same symptom, and what we have in terms of evidence doesn't show anything that you have. Maybe you should consider going to a psychiatrist and see if you don't have panic attacks instead. Because a panic attack later in life, I had one, and it simulates everything like a heart attack.
Yeah.
And I guess he probably went because I stayed there in this hospital, and he didn't go back as often as he was coming. So sometimes admitting your ignorance is also a way of helping the patient. But most of the doctors, they cannot deal with failing, the failure sensation that it gives to you. And this is something that we need to think about the patient, not ourselves, right?
Yeah, I think the failure that it's not good, because you are failing with someone that trusted you to give a correct treatment and a correct diagnosis. And I think it's harsh, but you are right. We have to admit that we can go to a point, and there is some point that we don't know how to go even further. So we have to say that the patient has something that you don't know. But the problem is some doctors they order the Lyme disease test, and the Lyme diseases come positive or not so positive to do the diagnosis, and they say to the patient that they don't have that disease. So it's more harsh, because the patient start to think that they don't have the disease, and cut off on a list, and and go to another directions, and with that they miss the to be right treatment, the right treatment.
I understand. Marcelo is having another question. He asks, what is the risk of getting in contact with contaminated ticks in cities? It is common to have deers walking around, and I found some ticks on the trees around the house afterwards. So how would you approach this situation?
Because chicks can be carried by birds, so it's a problem too, because you think that you don't have deers around, but you have birds around. I have some patients that live in a house with like yard with trees, and the ticks was transported by the birds. So I we have to take care, because here in Brazil we live with the mosquitoes, and the mosquitoes we have it in all the places. So we need to pass some kind of substance that can avoid the mosquitoes, and we can use it by ticks as well. So it's something like we have to start to think about, because the tick it's a universal being. We have ticks in almost all the weathers, and all the continents. So when we start to cut off the trees, we start to live more close to the forests. The ticks will not update the deer and start to updating the hat, and start to updating the birds. So it's something that Lyme disease is called the environment disease, the 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 climate change disease, because of that, because we start to live more and more closest to the forests, and the ticks are universal.
I have here Dr. Leona saying that she has a holistic management to approach immune diseases when she treats chronic illness as a coach. In your case, how would you expose your approach, your management?
In the first phases, I use antibiotics. In the second phases, I do immunomodulation, and in all the time, I have to say to patients that detox is important, because when you treat Lyme diseases, is not hard, that it's not uncommon that when we start to kill the bacteria, there is a lot of proteins that bacteria has to start to spray about your system, and we have to like wash out that kind of proteins, and detox is important. In mostly we have three kinds of way to do detox, or you will sweat and lose the toxins by the skin, or by the kidney filtrations in the urine, or by the TGI system, and you eliminate toxins by your stool. So the detox are methods to work well to three kind of systems, and it's nice. It's important to do in the treatment. And in the immunomodulations, I always say to have a good diet and do physical exercise during all the time. And there's a lot of there's a lot of therapies that patients can do too, like the psychotherapy and another therapies that can work together.
Like
Uh,
adjacent techniques like ozone therapy, or maybe uh, Chinese Chinese medicine, things like that.
Here in Brazil, doctors can't indicate ozone therapy because it's not approved by your council. And but there are some Chinese therapy that patient can use, like acupuncture. We have it here, and Olex therapy works too, because there are ways to the patients to recognize more your own body. So there are a lot of ways that can work in that too.
All right. We have people from everywhere here. We have people from Finland, from Germany, from the US. And I mean, like, we having a very good reach of people that are all around the world. And I was researching a little bit of Lyme disease, and I guess the only continent that it's not a very prevalent is Australia. All the other ones, they had found that
No,
ticks.
they have in Australia too. But
They
Australia
do.
has a problem here here in Brazil, that they say the disease doesn't exist. It
Mm-hmm.
don't exist. Uh, they have that problem too in Australia.
Oh
But the
my.
only continent that don't have ticks is Antarctica. Is the
Oh
only
my.
continent, because all the others have ticks too.
Mm-hmm. So it doesn't matter where, if you are not careful when you are walking outdoors, you can get this, and it's becoming really an epidemic, right?
Yeah,
Mm-hmm.
yeah. Look, how I say, in the South continent, we still have the mosquitoes. That mosquitoes is the deadliest animal in the planet, but in the North continent, the tick is the problem. I have a lot of patients that lives in Europe that has contaminated Lyme disease, and how I see that they have a problem in diagnosis and treating too, because there are a lot of doctors that don't know about the disease. I have some weeks ago a child that have been in Italy and have been biting by a tick. And the mother talked to the doctors there, and they see that there's no problem or Lyme disease. And when she come back to Brazil, they did the Lyme disease test and it was positive. So
Wow.
so they treated, and now there is a come negative, but it was in a place that they don't say anything about Lyme disease in Italy. So the disease is spreading.
Yeah, the disease exists despite the people not knowing about, or even the doctors not knowing about. Here in the US, you have to find like a Lyme literate doctor to take care of you in case you have Lyme disease, because it's not all the doctors that know or know how to treat it. So there is another step that you need to find somebody that is trained to do that, right?
And it's quite expensive,
Mm.
because all the treatment that is not covered by the health insurance. So it's another problem that you have there in USA.
Right. One thing that I found to be really true here in the US is that SUS is like a paradise because the health system here doesn't offer you a third of the possibilities that we have in Brazil. We kind of complain of the health system there, but it's really good and gives us the patients the possibilities of being treated of a lot of diseases that they would simply die here because if you don't have health insurance, you don't get treated.
Yeah, I had these days like some kind of reporter from Washington Post who was here in Brazil, and he suffered an accident and was treated by the SUS, and he was surprised about they don't have to show any kind of documentations, no any kind of health insurance like documents, and he was treated here. Yeah, so the problem is that a good health for a health systems cost money. I have a lot of patients that lives in Europe, and they have a lot of problems with the health insurance, the health systems too. Like to see a neurologist, they like wait like a year. So
Wow.
it's like a free system, but has some has some problems because it's costing a lot of money.
Right.
Not for the person, but for the government, and they
Mhm.
paying taxes.
Wow. Yeah, it's not easy. What I kind of came to believe when I was living here in the US, people think and come and ask me, oh, is it better than Brazil? I say, no, it's just different because every place has its goods and has its bad parts. Actually, we find out that your heart is where your family is and where your heart belongs. That's your home. But the place in itself, it's not good or better or worse. It's just different.
Could be good in some areas, but bad in another ones. But I think here in Brazil we have some serious problem about security because we have a lot of difference between the classes and the economic classes, and is not a place that you can walk in the street without some kind of fear, and it's a real problem here. And but you have problem in USA too,
Definitely, depending
like
on the place you go. We have another question here from Isabelle. She's in Finland. Can another chronic illness, such as one caused by Epstein-Barr virus, mask the symptoms of chronic Lyme disease?
I see different. There's a lot of USA doctors that treat Lyme disease that they think that the virus infections could be like a co-infections Lyme disease. It's different that what I see here in Brazil because the Lyme disease can cause a immune disorder, and in that immune disorder, the patients could have like EJM for Epstein-Barr virus or cytomegalovirus or another herpes virus. So I not see like a different disease. I see that we are treating organism with immunological problem, and that organism start to produce antibodies that can be seen in the exams, but don't have the real disease too. So the patients with Lyme disease has Lyme and start to produce antibodies for like ABV, and the doctor sees that EBV and see that, oh, they have IBV too. It's not the way that I see, because they the antibodies that is in exams, it's like not true antibodies.
A true infection would be more a immunologic scar, let's put this way.
No, because it's EGM. It's not a scar.
Oh, right.
It's
Yes,
like
right.
they start to produce the antibodies not because have the disease, but it's because the immune system is facing some problem. So
Right.
it's common that the patient has the Lyme, and not the chronic EBV.
Right.
Yeah, and if we start to treat Lyme disease, it's not uncommon that the immune system will start to work well, and that EGM antibody will start to low. So,
Okay.
but when we talk about like a chronic EBV, can mask Lyme disease. It's common because the symptoms are very similar,
Mhm.
and the patients start to take some kind of antivirals, and the EGM don't disappear because the problem is not the EBV, it's Lyme disease simulating EBV, producing IgM for EBV.
Interesting. And even in the Lyme disease, most of the times the EGM is what persists. You cannot really find a lot of EGG in Lyme disease patients. Is that what you see too?
Yeah, because Lyme disease is different from another disease. First of all, Lyme disease don't cause a scar, so it's different from that common disease that we see EGM in the acute phases, and after that we see EGG because it's a scar. Lyme disease don't cause that, so it's common patients that don't produce EGG and produces only IgM. So IgM Lyme disease don't we can't see it like an acute disease because there are some patients that produce IgM for years. Another thing that I do, and you can see it in the CDC pages, that we don't have an ism that show that patient is free from the disease, because there are a lot of patients that produces antibody for years. So when you read it in the CDC pages, it's a correct information. When we talk about Lyme disease, it's important to have the serology in the first picture, but after that, the serology, the antibodies in the blood don't. We can't see it like if the disease remains or not, because a lot of patients has the antibodies without the disease. In Lyme disease, we treat the disease, the bacteria goes away, but the organism start to maintain the antibodies production. So the antibodies is very good for the first diagnosis, but it's not good to like,
Follow up.
yeah, for follow up.
I see. And there is also the case that sometimes the serology is negative, and the patient cannot get treated because he doesn't have clinical evidence of the disease. And actually, there is like a test that you can do in the urine that is going to show something, right?
Yeah, because we have ism is called Western blotting, and Western blotting see for antibodies against some proteins of the bacteria, and we have like a number of of proteins to be positive to come with the diagnosis. If you have EGM, we look for 3 proteins, and we have two positives to diagnose the disease. And if we talk about EGG, we look for 10 proteins, and you have the exams have to come with 5 proteins positive in EGG to diagnosis. But why 5? Why not 4 or not 3? If you have a patient with a lot of symptoms, why don't 3? So we have to look. It's important to have that isms, but it's important to see the clinical picture of the patient too. I don't know if it was your question.
Yes, definitely. And in a sense, the clinical picture is always more important than any test. At least that's how I was taught in med school, because you talk to the patient and you check its symptoms, and this is more important than anything. Most of the times, the patient give you the diagnosis just by talking. And this is a very kind of antique technique that most of the doctors don't use anymore, unfortunately.
Because it needs time.
Mm-hmm.
And it's more easy to do some tests. Now we have more confidence in the tests than in what the patient is saying. So in that case, it's difficult to do the correct diagnosis in Lyme disease.
Mm-hmm. And by the time you just use the protocols for Lyme disease, that is not true. It's more like an individualized approach where you listen to the patient and examine the patient more than tests, right?
Yeah, because the diseases can has different forms. There's a lot of patients that has joint problems, that a lot of patients that has convulsion, that patients that has like psychiatric symptoms. So we can't treat equal patients with so different diseases, because the diseases, like I say, use the immune system, and the immune system is different from one patient to another.
Mm-hmm.
So it's important to do a treatment for each patient that will be better for each one.
Absolutely. Well, our time is up, and we could keep talking about Lyme disease for 1 more hour if we had time. I do appreciate you taking your time to be here with us. It is always a wonderful thing to be able to help in terms of the Lyme disease awareness, and I am glad to be doing that with you. And I recommend our people that are watching, if you enjoyed this conversation, you can also check Dr. Levischi's channel in YouTube. He has a channel there too, right?
The
And
problem
I
is in
think,
Portuguese.
yes, that's right. But he has the Instagram that is Carlos Levischi, right?
Yeah,
Is it correct? So he can also answer questions, or you can get in contact with him and he can answer you personally in English, right?
no problem.
And yes, and thank you so much. In the next channel, in the next live, we are going to have Professor Roberto Leimig. He's going to talk about immanent energies and evolution. And thank you so much for being here. And we do appreciate Dr. Carlos being here with us today. And whenever you want to come back, please feel free to talk to us. It's always a pleasure to be here with you.
I appreciate the invitation. I hope my English is sufficient for the most of the people understand what I try to say. And again, thank you.
Okay, see you next time.
See you. Bye-bye.